Thank you. Well, good afternoon, everyone. I guess I'm between us and lunch here, so we'll move out smartly, and hopefully this will generate a little bit of interest and conversation. I'm Don Orndoff. I'm the Senior Vice President for National Facility Services for Kaiser Permanente, and in that role I have the capital program, which is fairly robust for Kaiser, and also our clinical technology, biomed, as well as the facilities operations part of the business. So it's pretty much life cycle of facilities, so it's an interesting perspective to have. And I'd like to share a little bit of insight of what's going on today in Kaiser Permanente. We're focused now on total health and thinking of health beyond health care. So I'm going to kind of do a little setup and a little video of what that's about, and then I'll get into a more specific case study, if you will, of what that means and how that translates into the built environment. So hopefully that's something of interest, and we'll launch into that. First of all, a little bit about Kaiser Permanente. Kaiser Permanente is a large not-for-profit. Some would argue that it's the largest not-for-profit healthcare organization in the country. It depends on how you measure it, of course. There are lots of different ways to measure that. But you know, this shows some of the statistics here. It is big. You know, we're very quickly approaching 12 million members. Over the last year, we've grown 1 million members. So we're definitely on a big growth profile. Our CEO would have us going to probably 15 million members here over the not too distant future through a combination of organic growth, increased market share, and some merger and acquisition kind of activities. Recently, we just acquired Group Health in Seattle, which was a large stair step, about almost 700,000 members. So that was a big chunk of that million, obviously. In terms of dollars, about $65 billion annual revenue. You know, if we were for-profit, that'd put us about 40, 45 on the list to give you some sense of the scale. We operate largely in California. About 2/3 of our business is in California, but we also have a national presence in 7 other regions across the country. We're about 225,000 employees now, the largest private employer in the state of California. And a lot going on in this space. You know, with this growth profile, kind of how all the dynamics in the healthcare industry, as you might imagine, it's pretty hard to have a strategy that you can see very far downstream and actually suggest that you might land there. We're trying pretty hard to develop that strategy, invent that future, if you will. And some of this work I'm going to be talking about directly is what Kaiser Permanente aspires to be. From a facilities point of view, right now we have 39 hospitals. We have about a little over 700 medical offices. So we're pretty heavily vested in the built environment, the footprint of healthcare. Everybody wants to know, hey, with all the technology advance, when do we get out of the building business and medical? And I say, well, not so fast. We're still working on a lot of big projects, and that's still the platform that we exist on. Kaiser Permanente is a vertically integrated healthcare system, which means that we have the health plan or the revenue part of it. We have the hospital and the physician groups all together collectively in one organization. So that creates a pretty powerful model in terms of managing the health of that population. But what I'm going to talk about here is how do we take that even further? How do we take that into the communities that we serve, which is part of our mission statement? And like I said before, the definition of that is total health. And we're defining this internally in our organization across these over 200,000 people through a conversation called the shared agenda. And I'd like to share with you a video that talks to that shared agenda.
healthiest time in my life was when I was a little child.
High school.
5 years ago.
My childhood.
High school.
My entire life.
And I was a hiking leader.
More recently.
Right now.
Throughout my
I
life.
think I'm at one of the healthiest points in my life.
A healthcare system that really works would be one that is taking care of the whole person, their psychology, their physical health, their emotional well-being, taking care of the whole family, and taking care of the whole community, and taking care of the whole country.
We're on the cusp of enormous breakthroughs in medicine that will transform how we treat disease, how we give back life, and how we give back the quality of life.
We will be connected in different ways in terms of gathering information about your health status using biometrics.
You can envision a world here where a doctor gets to spend 90% of his time really doing what he is passionate about, assisted by these technologies.
It enables us to get immediate feedback about how our bodies, minds, and brains are behaving.
And we're able to tailor treatments based on an individual's needs.
Not only predict what happens to an individual, but to prevent it from happening in the first place.
The future is keeping people healthy, out of acute care.
And you're looking at the entire patient or total health.
To look at our brains, look at our minds as part of our whole body.
Mental health is also around mind, body, and spirit.
Are we taking the time to understand not just their sick care needs, but their emotional needs, their financial needs, their spiritual needs?
You're not just prescribed some sort of drug, but rather you are included in a group discussion.
Success would look like people also taking care of themselves and taking care of each other.
Real health comes from not necessarily the fancy science and technology, but about how you choose to live your life.
You just see more people being out and more active.
Gardening,
Cycling, walking,
eating well,
healthy public transport, less cars.
Grocery stores, the gym, school, they're all close enough proximity that you can walk there.
Where buildings meet the road, that's where we can design at the scale of a person and the scale of a community. That's where we can make that a beautiful space that encourages healthy behaviors.
How do we make sure that we have the right policy, systems, and environmental changes in our community so we can grow, live, and learn in a healthier environment?
Convening with partners in our community around everything from housing and economic prosperity to jobs to health care to education to access to food and to having safe places to walk.
Connecting to those institutions that are important to the populations in those communities is how we will drive change.
Unless we look at healthcare and housing and economic development and legal protections together, we won't be able to empower an individual or a community in their social progress journey.
So this is the conversation that we're having now, and these are 4 core beliefs that we've developed that we see to inspire everything that we're doing as part of Kaiser Permanente. It's about, creating access for everyone to health care. Obviously a big political conversation that's going on today. It's about creating an affordable scenario where people can afford to invest in their health, something today that's challenging for many families. It really is about this confluence of mind, body, and spirit, well beyond getting good health care, but thinking about a person's total well-being. And it's about living an engaged life with good beginnings and dignified endings. So that's kind of our shared beliefs within Kaiser Permanente, and that's organizing and orchestrating much of what we do today as we look at the future of our organization. So what does determine health? There are many factors, of course. Great health care, which, intuitively I think most people would say is a major contributor. The reality is that's important, of course, but it's really only about 20% of the determinants statistically of health. By far the biggest is your socioeconomic environment, where you live, the community you're in, the fabric you're in, do you have a job, do you have an education, et cetera. So what can a healthcare organization that's focused on community health do in that space? The fact is we can do a lot, and we are starting to do that. And I'm going to talk about a project here in a few minutes called Bowen Hills Crenshaw that I think is a good case study in this. So, clearly we're spending a lot of money. Can we generate enthusiasm in the economy and movement in the economy? Can we contribute to better lifestyles and healthier behaviors, which is another component of this? So let's jump into this project. Back in the 1940s in western Los Angeles, there was this area called Marlton Square in the Broadway Crenshaw area, a vibrant area. One of the first indoor malls, I understand, was here. And you can tell from all these fancy cars parked out front. You won't see those today, of course, maybe a few vintage ones, but a different time. Then all of a sudden, this part of Los Angeles started going downhill. Lots of social unrest, inequality, lots of things that we continue to talk about today were very, came forward in very dramatic and unfortunately ugly ways. Terrible strife in this area, eventually getting to the point where it became essentially a wasteland within the city of Los Angeles. I went to do a community benefit effort there at the YMCA right next to this, and literally there was a lot of discussion about security, et cetera, and what time of day it was appropriate to be there, et cetera. And you'd hate to think that that is an environment where people live and grow their kids and try to thrive. So what could Kaiser Permanente do? So really, this was a case where we looked at how do we come into this community and make an impact? I'd like to show you a video that kind of gives an overview of the project, and I'll talk some more on the back end.
I've lived in the Bowen Hills community for the last 21 years. Community has been so neglected for so many years, and Kaiser Permanente decided to invest in this community, giving us a completeness with our overall life experience. We have clothing, we have food, we have shelter, now we have access to health care.
Well, this is a very important facility to have here in the community. We know that rates of diabetes and other chronic diseases are very high in this region, and it's wonderful to see the excitement of the community members.
As we were developing our community health improvement strategy at Kaiser Permanente, we realized that in order to improve the health of our communities that we're in today, we really needed to look at the upstream social, economic, and environmental conditions of those communities. And if we don't address those issues, we will not make the impact on health that we need to in inner city communities where there can be great disparities in health outcomes and the health conditions of those communities.
We have a long history in this community and a lot of trust between doctors and the patients here in Bowen Hills Crenshaw.
This area was synonymous with suppression, gang violence, things of that nature, drugs. But now we have a state-of-the-art medical office building that was built primarily by individuals from this community who probably used to engage in those type of activities, and now they have careers based on this particular project.
Well, this was a great project in terms of how we engaged the local community from the beginning in the design concepts, in the planning and layout of the space.
To be over on this job in the neighborhood and have a lot of blacks out here, it makes me feel proud to be out here working on this site.
I think what made this project unique was the community element that was woven in really before we ever put shovels in the dirt or started to build this project at all.
In our massive lobby that we call the public square, it really looks more like an international airport. It's open and airy and wide with great natural light, and we want people to just explore the space and enjoy it.
The first thing the members are going to see is a lot of smiling faces. Making sure that you're checking in with everyone and getting everyone's thoughts and concerns sometimes may take a little bit longer, but it's the right way to do it, because at the end of the day, what we want is the right outcome.
Yes, this facility is chock full of innovation. In fact, it's almost limitless. There are 15 new information technology improvements that are in this facility that have, in most cases, never been done by us as an organization or anybody in healthcare.
It is what community will use to improve its own health. And the design reflects that by having a community center, conference center that is totally independent of the medical office building that we have built.
It's really about how can we become a trusted partner in the community? How can we be there in conversations about the future? What are the future needs of that community? How do we stay ahead of that? How do we become part of the solution for the community? And how do we really innovate based on what we hear, getting that feedback constantly so we know what are those needs?
I think definitely in this community it's really going to save a lot of lives because they don't have to really travel too far to go to get their medicine or go get treatment or go get stuff like that from the hospital.
From a person who grew up in Lamert Park and went to Crenshaw High School, this is an amazing opportunity for the community. I'm excited for my community to be able to have this and have access to Kaiser Permanente services.
I'm looking forward to making sure that health equity is established here, that what we expect all over the rest of the nation and even in this city is established right here.
We'll take the lessons learned from Bowen Hills Crenshaw, which I think is a slam dunk success story by any measure. We'll pull the pearls of wisdom that we've learned in that, and we will apply those as we go forward. Cultivate is really a mindset for us now in terms of community engagement and making sure that these huge investments we're making in these facilities really does have an impact that helps the community not only with their health care, but in broader terms of the community's health at large. So this was a pretty exciting project to be part of. Again, you know, this part of the city had been, you know, a political football, if you will, for, you know, decades. And it's easy to make excuses. It's easy to see the rest of the communities surrounding move on and to come in and make this investment and to engage the community in a new and more challenging, a different way, I should say, was just absolutely a great experience. It's not easy, it's hard. There are lots of different perspectives and, you know, for somebody who's, you know, been a project manager and thinks about, you know, scope, schedule, budget constantly, you know, this is like the worst nightmare of anybody who's worried about scope, schedule, and budget. How do you engage in a meaningful way and be willing to go where, you know, the need is and so forth. But it was really kind of a labor of love for the people that worked on it. Again, a lot of community outreach, bringing in all different facets of the community, talking about what does it mean to have these kinds of spaces, how can we design this building in a way that is responsive to the community. You know, there was talk about pulling out things like community centers and so forth. So rather than having conference centers embedded in locked up buildings at nighttime, these are available, not only available, that they're promoted for the community use. So lots of outdoor spaces, walking paths, things of that nature that promote health. The amount of money spent locally, you saw some of the statistics. I think it was like 40% of the entire spend was within that local area. The workforce, almost 50% local hires on the workforce that constructed the building. One really interesting piece of that is an organization called Second Chance. Second Chance is an organization run by people that had been incarcerated in their life and want to help others make that transition. And you know, that's a chronic problem that we have in our society today. There are 10 people that literally were coming out of prison that were given a second chance to work for Turner Construction on this project. Turner did a magnificent job of outreach and engagement here. And those 10 people represented over 200 years of incarceration. Think about that. And today, those 10 people are now, since this job is completed, are now working on other Turner jobs in the greater Los Angeles area. That's a pretty big deal. Just think of the ripple effect, just giving those 10 people a chance, you know, to now, you know, have a good paying job, earn a good wage, and then contribute to society in a powerful way, completely the opposite of their prior experience. That's pretty amazing. There's actually some information, if anybody's interested, I'd be happy to share it with you that, you know, it's pretty hard to not get choked up when you watch it, to be honest with you, to see this kind of transformation happen. So, you know, so here we are with a bunch of political leaders breaking ground and trying to, you know, say, what is it going to take to really pull this thing off? And it was pretty amazing. You've seen the result. It's a beautiful new medical office building, state-of-the-art in every way, technology in terms of how it, you know, again, addresses the community. It's currently LEED Gold, but as soon as we get our permitting for the solar, it'll be LEED Platinum. It is, you can see some of the engagement here, you know, where the conference centers pulled out, you know, exercise paths, exercise equipment. It's amazing when you start talking to community reps about how to pull this all together, how excited people get and want to contribute. So that's kind of our new thing now. We're going to really be thinking about not only how do we continue to invest this huge capital program that we have in Kaiser Permanente, but how do we target it in ways to make a real impact on total health? These are some of the spaces. Again, you saw it in the video, but you know, this is as good as anything you'll find in any upscale community anywhere. And this is about the health equity issue. We have been working very hard to make health outcomes for the African American community, other communities on the same level, so literally everybody's getting the same great level of care and has the expectation to receive that level of care. You can see some of these technologies. Gone are the days of big waiting rooms and so forth. Everybody is now, you know, we have apps that tell you when it's time for your appointment and all that. So in the meantime, you can be out and about enjoying the sunshine or, you know, learning something about how to do healthy cooking or whatever in some of these public spaces. That's really pretty cool stuff. Again, you know, from the good old days to the not so good old days, and hopefully some better days that are coming as a result of this kind of investment. There's just so much enthusiasm now in the local community for this, and we're just so excited about working on more and more projects of this nature. We have another medical office building in Watts in Los Angeles, another area that's had some tough times, really trying to target these investments to give better medical care and better support to communities that deserve it. Shifting gears a little bit, you know, what we're doing in Kaiser is we continue to look at reimagining our ambulatory care experience. So we've been moving away from, you know, the more traditional models and standards of so many providers and so many exam rooms and so much of this and so much of that, to really trying to redefine that experience. So you can see here's some examples of some of the medical offices we've been delivering. All of these spaces are very much focused on teaming. So you won't see big doctors' offices anymore and all that. We're repurposing all that space. It's kind of hard to get the physicians to go along with that initially, of course. But you know, when they see what the impact would be with taking a smaller footprint and kind of reconfiguring and thinking in terms of teaming and working with our members and patients, it's been very, very exciting and rewarding for them as well. We try to give them great spaces so they feel like the trade-off is, hey, I'm losing my little personal space in my office, but we've got great teaming spaces and other spaces to work with. somebody asked me, what in the world is that one up in the corner there? This is actually a small medical office building in Santa Cruz, California, so of course we've got to have the surfer feel and so forth. You won't find that in all of our facilities. For instance, we're now moving big time into mental health and doing lots of mental health care facilities. That's the big part of our model that remains underserved, and I think that's a general feeling, of course, in our country that mental health is something that we've got to do better at. You know, just the horrible tragedies of the last few days would certainly, back that up. So we're big time focused on that. We have, literally dozens of mental health facilities. We do integrate with our primary care, and we also have standalone facilities as well to address mental health. Here's another example. These are ones that won our Kaiser Permanente Design Excellence Award for 2017. We run a little internal design excellence competition, and we're always looking for jurors, so if you're interested in being a juror in the next cycle or beyond, let me know. This is a great project that we did in Sacramento. It's actually a sports medicine clinic. It's actually embedded in the Sacramento Kings arena. So we take care of the health needs of the Sacramento Kings. Right now, I think that's pretty tall order. So the same physician that's seeing, the starting forward for the Sacramento Kings is also providing sports medicine care to our members. So that's pretty cool. This is a beautiful new facility right in the downtown of Sacramento. This is another great example of how we've exploded the primary care facility to be much more inviting to the public. This, I think, is maybe our best example of that right now, Chino Grand Medical Office in Chino, California. As you can see from these spaces, it almost has this kind of a mall feel to it, where we've pulled out all these spaces so they can be used after hours and purposed in lots of different ways. It creates an atmosphere that's just not typically found in medical offices, at least Kaiser medical offices of the past. This is our latest hospital, San Diego Medical Center in San Diego, California, obviously. This is, again, state-of-the-art. This is our 39th, our latest version of a hospital. This was the first LEED for Healthcare Platinum hospital in the state of California, I think second or third in the country, and we're very proud of this. Just a tremendous amount of innovation went into this to redefine the experience of being in an acute care facility. Obviously, it's there's some things that are structured and very regulated, but there's lots of opportunity to do things differently, and I think we really went at this. The energy efficiency of this building, many ways of looking at this. It was kind of set the bar anew for us in Kaiser Permanente, and we're very excited now. We're planning and programming our next medical center in Sacramento in a redevelopment zone called the Rail Yards, and that will be raising the bar again. We don't know how we're going to do it yet, but we're going to work very hard to make sure that that one is even more successful project than this one. I always had the pleasure of briefing our board of directors on these major projects, and this one was almost embarrassing. I said, it's ahead of schedule, it's under budget, it's state-of-the-art, all the technology, all the whiz-bang is in there, and oh, by the way, it's going to be LEED Platinum. That was a pretty good, easy conversation with board of directors, especially after they heard about all those IT projects that were over budget, right? So, okay, so this is the kind. Unfortunately, now we've got a pretty high bar to scramble to as the next project comes along. And of course, there's the ever-present affordability strain of bending the cost curve. One of those core beliefs that I started out with was how do we make healthcare affordable to people? Because if you can't afford it, all the access and all the great buildings and all the great physicians and capability are meaningless. Coming down, super small scale, small medical office building. This is in our what we call Mid-Atlantic region. This is located in North Anne Arundel in Maryland. Again, very small, very compact, different kind of feel, has a very open and inviting, very technology leveraged facility. And I think that might be the last slide that I have. So with that, I hope that inspired a little bit of thinking about how you look at this concept of total health and community health, how a large organization like Kaiser Permanente can put some walk with the talk, quite frankly, make some big investment, make some big bets, engage in neighborhoods in the past we've kind of shunned away from, and really try to kind of redefine the conversation of what is health in the United States of America. So with that, I'll pause and see if there are any questions or comments or different perspectives on anything I've said. Any questions? Reactions?
I'll bring the mic over to you.
Yes, sir. So the question is, do we use standard templates for rooms and things of that nature? The answer is sort of. We do have everything templatized to the cows come home, and you would like to think that there's a default answer, that in our design criteria we've worked through templates, mostly at the room and department level. We've tried to avoid trying to template entire buildings or getting definitive designs and things of that nature. Part of it being because of the wide variety of different microclimates and site conditions. But also, I think it's just, we don't want it to be, cookie cutter. We want it to sort of react to the environment and the community. But we do a lot of definitive design in terms of room templates and so forth, and we're trying to take that even to the next level. If you go into one of our exam rooms today, you'll see the kind of, it's different, big telehealth screens instead of, flat, whatever that thing is. You have a normal chair, that kind of stuff, and it kind of seems a little more inviting. But there's still a lot of stuff stuck on the wall, a lot of cords hanging down and things like that. So what we're doing now is we're saying, okay, if this is our standard room design and we're going to build 600 of these over the next few years, let's really dial this in. And so we're working with some really high-end design firms to really talk about how we can take this to the next level. We're talking a lot about prefabrication and modularization. By modularization, I mean getting to very standard kind of chassis, if you will, and then you can plug and play all the different components depending on what the program needs of that particular building are. We're talking about getting big time into prefabrication and basically investing in the supply chain. Because of the volume that we have, if we can find ways to do massive prefabrication, that will greatly reduce cost, it will greatly increase quality control, and speed to delivery. And right now, because of the growth trend we're in, speed to delivery is probably our #1 issue to address. And that, gosh, it's always something, isn't it? It seems like if it's not too expensive, it's too slow. So we're really working hard to address that. At the same time, we're trying to continue to innovate and try new things. So it's almost kind of the two are in tension. We could standardize and get that really locked in, but then that would be somewhat static. How do you innovate while you standardize? That's kind of the real question. And so we look at every project as a new opportunity. We have a big volume of projects so we can iterate quickly. We can try things. Okay, that worked great. Nah, that one wasn't so hot. Now we can move on. We need to get a lot better at post-occupancy evaluation and really get a very continuous and meaningful feedback loop. So we're working across all of that. There's a lot of pressure to standardize, and there's a lot of pressure to go with best business practices or best solutions. The problem is we keep figuring out what a better one is. so I think that's a good thing, and we'll keep working that on both sides, I think. Anyone else? Anybody else talking like, you know, their organization they're come from is talking about community health and that kind of thing, or is it something that is just sort of left up to somebody else to fiddle around with?
Hey, Don?
Yes, sir.
What's over here to your left?
Oh,
so what's your source of capital? I mean, between philanthropy, cash flow, bonds, you know, just, you guys have lots of money, it sounds like.
Boy, we're rolling in dough. No, no, we have none of that, actually, to be perfectly blunt. It's all based on people buying health insurance. Our model is prepaid health insurance, classic HMO kind of structure where, you know, based on some analysis, we say the cost is this, and we go to the market with that price point. And if you come on with Kaiser Permanente, then you're going to get the full spectrum of care from primary care and preventive care all the way through, you know, major surgery and intervention in an acute care environment. We don't have, we're a not-for-profit, so I guess you could call that philanthropy from the taxpayer. I don't know, you know. But of course, with that comes the duty and the mission to meet the community need. And of course, that aligns exactly kind of with the ethos of the organization. So that's not an issue. We spend literally about $2.5 to $3 billion just on community benefit as part of our not-for-profit status. But it's a $65 billion annual business. So there's a lot of money flowing through the pipe. Our third quarter results just came out, very strong. You know, we're looking at another great year. And boy, you know, it's good for a guy like me because, you know, that, quote, profit in our not-for-profit is now plowed back into investment and making it better and more capable for our members and expanding our membership. And of course, as we expand our membership, we can spread some of that fixed cost over a much broader base. So we have a very healthy, you know, I meet with our CFO almost, seems like daily, and she's actually embarrassed about, you know, the fact that she has to worry about making too much profit. And she's embarrassed, not embarrassed, but I mean, we have to keep all of this in balance. So sometimes when things are turning favorable, we'll tighten up in some other areas. And of course, we're always trying to reduce our price point to make it more affordable. That's kind of the key to this, is how do we make this great care affordable? And you know, that's the mission that we're on. So whenever we have you know, the opportunity to go beyond just great health care, that's where the real investment and opportunities are. And that's kind of the business model that we have. Yes, sir. Mr. Powell.
Okay, I know you're interested in innovation when we think about the design and construction process. I know you tracked innovations in the past. What sort of, in which areas of the design and construction process would you like to see more innovation occur?
Well, I think the great opportunity is how do we change our medical facilities to be facility and institution focused and being people and member focused. You know, you don't have to be a rocket science to figure out people now expect convenience. You know, the Amazons and Ubers of the world have redefined expectations for people. In the good old days, people would travel and go through whatever because, you know, that's what you do when you go to the doctor. Now people don't want to do that. And in fact, people won't do that. And that's really, you know, a big challenge for our healthcare system in our country, I think, is that if it's not super convenient and almost spring-loaded to happen, it's probably not going to happen, because if you have to initiate that interaction. So we're going much more upstream into the virtual world and trying to interact almost intrude, if I could use that word, in people's day-to-day lives to say, healthcare, your health is important. What are you doing today about your health? And if you can start that thinking going on in people's heads, then the rest of it flows a lot better. So the innovation, quite frankly, has been, how do we take this big old lumbering healthcare system and turn it into light and lethal, that, is very easy and agile and adapts to people's needs and wants. And a lot of that's through information technology. Obviously, we've invested a lot in that. We had those big old behind the curtain mainframe kind of things. Now it's all, of course, very digital and agile. Part of it is how we redefine, the boundary between our buildings and the communities. I think you saw some of that in the presentation today. One of the speakers in the first video said that seam between the building and the surrounding communities where there's tremendous opportunity for engagement, and we're trying to exploit that opportunity as best we can. There's more we can do. There's, of course, countering forces, physical security, cyber security. Oh my gosh, how many in the room have spent a lot of time on cyber security lately? I mean, I'm living the dream right now. At Kaiser Permanente, we have almost 500,000 medical devices. Think of that, 500,000 medical devices, and every one of those is a potential hack opportunity for somebody out there. And unfortunately, our network was designed in the good old days when we didn't worry about this stuff too much, and so the architecture is not very good, and now we're having to go back and do lots of very expensive segmentation and so forth. But all of that, is challenging. So we spend, unfortunately, a lot in that space to protect all of this data, because data is what's so powerful here. The fact that, if you have, literally 12 million members and the health history and visibility of all that, and then as, we continue to advance in things like genomics and so forth, the amount of information will be amazing, and then the correlations between that and better health and health care are just falling out of that. Lots of issues associated with that, artificial intelligence and all that stuff, it's pretty amazing time. The thing that's always frustrating for me, quite frankly, though, is, this is the pace of the design and construction industry, and this is the pace of the real world. And the two are out of sync. And how do we get them in sync? I don't know. I'm struggling with that, So, we're planning a hospital, as I said, in Sacramento, that's going to be opened in 2023, all right? What's the world going to be like in 2023? Your guess is probably better than mine. So we're making lots of key decisions that are hopefully going to be good bets when we have that ribbon cutting somewhere downstream. So I think, those are the areas where we're trying to push it. Certainly, everything is going virtual. Everything is networked. Despite all the cybersecurity threats, we have to think in terms of managing information in a more powerful way. There's so much of it, and it's so rich. And, that's where the organization, I think, has a tremendous focus right now. Thank you.
Thank you.